My name is Kenya Servia. I'm one of the Business Development Outreach Specialists with the North Carolina Health Information Exchange Authority. Welcome everyone to our first quarter Teletown Hall, where we're going to be sharing firsthand user experiences. Before we begin, I want to start with some housekeeping items with regards to WebEx. Please make sure to enter your questions in the Q&A, not the chat feature, okay? And in addition to that, this presentation is being recorded. If you do have an issue with being recorded, feel free to drop from today's presentation. And if you are registered, you will receive today's presentation materials as well as the recording, but we do understand that not everyone likes to be recorded. So for an overview of today's Teletown Hall, we're going to start with introductions where you'll meet our team, our panelists, as well as we'll have a demo of our clinical portal, and we'll discuss our NC Notify enrollment process. So let's start with some introductions. One of our panelists is joining us, Mark Holmstrom. Mark is a quality improvement consultant and practice support coach at the Mountain Area Health Education Center in Asheville. He's also a member of the North Carolina AHEC practice support team. He has extensive experience in physician practice operations, hospital operations, strategic planning, and process improvement. He enjoys assisting healthcare professionals find new and more efficient ways of providing high quality and high value health care. Welcome, Mark, and thank you for joining us. Now I'd like to introduce Terry Roberts. Terry Roberts has extensive knowledge of current healthcare reform, regulations, and trends spanning 30 years of management experience with hospitals, physician practices, and ambulatory care services. In her current role at the Mountain Area Health Education Center, she provides consultation and support services to providers in Western North Carolina region of North Carolina in EHR optimization, practice operations, data and outcome analysis, revenue cycle management, and quality improvement, including NCQA, PCMH recognition. In her other role with NCAHEC as the statewide quality improvement manager, she provides training to all AHEC consultants as well as support and resources for statewide programs and initiatives. Terry has focused her career and passion on assisting physician practices on achieving and sustaining patient satisfaction, clinical excellence, efficiency, and profitability. And lastly, I would like to introduce Gerald Greer. Gerald has been a thought leader in behavioral health information technology for over 3 decades. In 2004, Gerald, as the Chief Information Officer, became a founding management team member of Daymart Recovery Services, a CCBHC organization that has grown to serve 50,000 patients annually through over 25 outpatient or walk-in centers, 7 inpatient detox or crisis programs, 5 mobile crisis teams, along with several ACT, PSR, residential, and intensive in-home teams. Through the last decade, Gerald's team has focused on continually defining and redefining electronic health record workflows that make medically centric, meaningful use systems more behavioral health friendly. Most recently, his team has been focused on optimizing workflows for Daymark's statewide tailored care management team, including NC Notify workflow optimization. Welcome, Mark, Terry, and Gerald, to our presentation on today. We want to start with the first question we want to give to you, Mark. Given your experience as a practice support coach, could you speak to how NC HealthConnex can impact care management and timely follow-up?
Sure. Good afternoon, everyone. Appreciate the opportunity to share with you some experiences I've had with practices that I work with. There are many practices that I know that use NC HealthConnex in the clinical portal to support both a formal transitional care management program as well as just day-to-day care management of the patients. Some practices that participate in transitional care management that get reimbursed for that process know that there are very specific requirements that must be met to meet the reimbursement criteria. And it starts with identifying patients that are discharged from facilities. And one way to get that information through NC HealthConnex is with a service called NC Notify, which can alert almost, in some cases, same day discharges, so the practice can start that follow-up process. The first step is contacting patients, and then they have to also schedule a follow-up appointment in a specific amount of time based on the risk of the patient. The information in NC HealthConnex, such as discharge summaries and notes from ERs and such, certainly can be used to determine the level of risk of the patient, and factor that information into the information you already have in the EHR to determine the level of risk, and determine how quickly you need to follow up on the discharge to make sure you're meeting the reimbursement requirements. In addition to transitional care management, practices are doing chronic care management, and really just trying to take the best care of their patients as possible. And all that really takes quick follow-up and comprehensive information that really can be found in NC HealthConnex as care managers review hospital admissions, ED visits, and even specialist care visits that should be factored into care management processes. So there are a lot of ways that NC HealthConnex can help care management teams provide high-level care management to their patients, and it really is a great resource for practices.
Awesome. Thank you so much. Okay. Terry, second question for you. Based on your experience, first question for you. Based on your experience working with specialists, could you speak to how providers will benefit most from NC Notify?
Sure. And thank you all very much. And I'm delighted to speak on this. And I'm going to piggyback on what my colleague Mark was just referencing with, except I'm going to give a twist to the specialist environment. A good example is that I work with a regional nephrology practice that use the filters allowed with NC Notified to upload a specific panel of patients to receive the notifications on, rather than all or every patient that they have seen that they have provided care to. And it just cuts down on the amount of notifications received, which is alert fatigue. They were having that in the beginning. So we got with Tim Taylor, and he helped us to upload the specific panel of patients. The filter, again, focuses better on those patients that are acute and need problem-based care. In this case, it was patients in dialysis. This particular practice is participating in a specialist or condition-based form of a CMS ACO dialysis model, and they're in downside risk. So with the downside risk component, care management is critical. It's just an important component. So once again, the providers and the care team can monitor the NC notifications daily for unplanned care and admissions, and thus they can provide immediate follow-up and treatment. In turn, NC Notify is an immediate way for the practice to provide transitional care management, and due to the fact they're a specialist, principal care management, and most importantly, improve patient outcomes and care.
Awesome. Thank you so much. Mark, could you provide some insight from your perspective about the impact NC Health Connects has on value-based care contracts for providers?
Absolutely. So value-based contracts generally have specific quality measures that are tracked and factored into shared savings or quality bonus programs. A few of the common measures are breast cancer screening and colorectal cancer screening. And I'm going to talk a little bit about how NC HealthConnex can help with those specific common measures. So these two are services that primary care providers order, but generally do not perform. So they rely on outside organizations or the patients to provide the reports of the completed screenings so they can get credit for the screening being completed in their measure calculation. So a key process practices complete to earn these incentives is called gap closure. And this is the process of notifying a payer when a screening was completed. And this usually involves uploading a report to the payer's portal. So one of the biggest challenges practices have is getting some of those reports back from external facilities. And this is where NC HealthConnex can come in to be very helpful. When practices don't receive those reports, they can go into NC HealthConnex portal and find mammogram reports and download those and then upload into their systems or upload to the payers. They can also find out when and where patients had colonoscopies or other screenings. So that provides information for the practice to reach out to that organization to get a report. So the wealth of information that is in NC HealthConnex really is very helpful and can really help practices with these gap closure processes and the ability to earn quality incentives and bonus payments through their value-based contracts. Those are a couple examples, but there are many other ways that NC HealthConnex can be used to help in that regard.
Great, great examples. Thanks so much, Mark. One moment. Now, Terry, I have another question for you. Could you share a specific example of how you've seen NC Notify or the portal impact the delivery of patient care?
I sure can, Kenya. And I'm gonna again use this regional nephrology group. And as I mentioned in the first question and answer, they are in a CMS ACO dialysis model that has downside risk. So you've got that component with value-based care, and you have some doggone pretty acute patients involved. So obviously, NC Notify is critical, as is the portal. And in this specific example, when a dialysis patient is out of area and is hospitalized or seeks treatment with another provider or facility, the NC Notify notification for this panel patient, because this is in that panel that was uploaded for specific notifications, it comes directly into the practice's EHR and basically into their chart and is immediately notifying the practice. These notifications are monitored daily by staff. The practice can reach out quickly to the rendering provider out of the region and assist with the care of the patient, allowing a continuity of care without additional testing, labs, or other services that the patient may not need, while coordinating care upon the patient's discharge and setting up immediately the necessary follow-up appointments with their assigned provider. You know, when you're in a downside risk model and you have very acute patients, this process is absolutely critical to the successful healthcare improvement or management of these acutely ill patients and their outcomes. And it also is addressing the cost factor. It's lowering the cost of care, and it's lowering the exposure of patients to tests and services that they may not need because their provider can get in touch with the rendering provider out of region and provide support information immediately. And, you know, it's lowering acuity. And then it's improving performance all around and giving our patients just a better care experience and improving their outcome. So that's just one example that we've seen that's had an immediate impact.
Wow, Terry, that is absolutely amazing. With that, Gerald, would you mind sharing, since you are a longtime user of our event notification service, NC Notify, could you share with us some examples of how you found it beneficial in your daily operations? And I'm going to stop sharing to allow you to share your screen.
Sure, thank you. Thank you for the opportunity to speak today. And just to be sure, can everybody see my screen now?
Yep, I can see it.
There it is.
Okay,
Yes,
great.
thank you.
I thought it would be useful to actually show how we have integrated NC Notify into our EHR and how it drives workflows. Prior to that, though, I wanted to preface that live presentation with a little bit of background about Daymark and what you'll see. Just a quick look at Daymark's brick and mortar presence across the state to give some kind of context to our agency. We have about 1,000 staff across all of those sites, and within those sites, about 60 prescribers. And we have a whole person care philosophy. Everyone is responsible for knowing everything that is discoverable about a patient or member, including NC Notify events. Daymark is a tailored care management agency, and as such, NC Notify ADT is not only useful, it's actually in our job description. So when we applied to be certified as a care management agency, we had to prove and demonstrate that we could integrate ADT information real time or near real time into our processes to be able to, as it says, respond to these notifications by contacting the ED to arrange follow-up and same day or next day outreach for designated high-risk subsets of population. So what we're going through and how we're utilizing NC Notify became a requirement. Notice about the presentation when we switched to the live system. Daymark's using NextGen Enterprise as an EHR software platform. However, the entire platform has been enhanced by Daymark's own development team. Consequently, the demonstrated functionality is not off-the-shelf software. For our HIE implementation, it's fully bidirectional, which means that our staff do not have to sign into the HIE to see patient records. But it is technically different than having an NC Notify interface. When I pull up our system, we'll see a dummy patient, and with panels, they're represented in confidential mode. Within care management, ADT, inpatient, and emergency department notifications are among defined triggering events that require action. And we take that a bit further, and the NC Notify ADT forces out our EHR to retrieve the latest records. So those of you who are familiar with CCDs or continuity of care documents, then those are things that we set up in a bidirectional interface to automatically pull from the HIE. So not only do we get the ADT notification of an inpatient admission, it also says, oh, since I got this, go ahead and grab that CCD too, so I don't have to sign into the portal in order to see the patient record. Daymark leverages the HIE also to create our own triggering events, including chronic condition alerts. For example, a chronic condition alert would happen when a new diagnosis of diabetes happens in the community, and it automatically generates a triggering event so that our care management staff can follow up with that functionality. So with that staging, I'll transfer over into a live demonstration mode. I'm now within my NextGen context. I'm going to go into the dashboard mode, and I have my dashboard set to simulate my being one of our care managers, Stephanie Wiley. And Stephanie Wiley has a caseload of 323, which is high for the care management program, but she belongs to the engagement team who front ends the program to make sure that we have that first contact, who then transfers them to be assigned a permanent care manager. So of course, we're focusing on NC Notify here. One of the things that we say about our triggering events across Daymark is that providers must know about the information, and we design the EHR so that they cannot not know what's going on with the patient. So we create insertions into the workflows that make them aware of what's going on, and we even require, depending on the program, require staff to acknowledge events such as NC notify events. This, while I have a caseload of 323 here, this represents the notification window for all notifications across Stephanie's caseload. She only has 5, and here we can see that we've got the 222 ED admission, and I can pull that up, I can acknowledge that, and I can even create follow-up tasks based off of that notification. Now, if I want to narrow to who those are in those triggering events, I can simply check everyone that has a triggering event, and it will narrow my 323 down to 2 members that have notifications. So I'll take a look at one in particular that where, we talked about this real time, right? So here we have a notification on 222, and that's when we consume it into our system. That's when we see it. And it just so happens that the discharge date is 222. So you can see the real timeness of that. Just at 9:25 this morning, they were discharged from Novant Health, and I'm getting that trigger in relatively real time. So as I said, also, when we get a triggering event, we also retrieve the record for that patient. So if I look at external CCDs, then I also see that I have the patient summary from HealthConnex for 222. If I click on that, I am then going to see the record just as I would see it in the HIE. That would get me past my confidentiality mode, though, so I'm not going to continue with that process. And I have another case here where I have 4 triggering events. This ADT is a little bit older, but this you can see how we have maintained a history of the reasons for the visits, the facility, and across time. And even further, within this case, we have this nice little feature called Panorama View. And when I select that, then I can see everything that is happening with a member, including their ADT notifications coming from NC Notify over time. So I have a chronological view, and I even see that Stephanie is acknowledging each of these ED admissions, just as we say we require. But we also have our internal events as well. So whenever we have additional documentation associated with something, we can click View. And so this is actually a live representation of the longitudinal record with events such as NC Notify inserted into these so that I can drill right in. If I want to see the full note attached to this, then I can just click on that full note, and I have a full history of that too. I also wanted to point out the chronic care indicators that I illustrated. Mark touched on gaps in care, and there's a lot of things that we need to deal with gaps in care relative to the overall circumstances of the patient. So each time that we have a chronic condition alert, then that populates in our dashboard the problems. And these problems, or SNOMED codes, as many of you will know, we have shorthand for these, where H is for hypertension, D is diabetes. And these are all coming from chronic condition alerts through NC Notify, or to some degree our enhancements to NC Notify. And I even can make that searchable. So within my caseload, if I want to say hypertension and diabetes, then it's almost like our own little smart search that we have tied to this, where everybody that I have now drilled down to these 2 conditions, then I am now bringing in here. Now, talking about closing gaps, then I can even expand that further and say if I want to show everyone that has hypertension, diabetes, and needs the mammogram, because we are responsible for closing those gaps in care, then it would show that as well. We've taken a little bit of that functionality out temporarily on the startup of our TCM program as not to overwhelm our care managers. That's something that we're getting to roll back into because our system is designed to consume HIE data and claims data in order to identify and focus in on the people that have gaps in care. In fact, it leverages the HID data as well in order for us to simply select a checkbox to say, show me everyone that has risks for gaps in care, and drilling down to the population that I need to focus on for that purpose. I think I've used up my allotted time there, so I'll stop and make sure we have plenty of time for Q&A when the time comes.
Wow, Gerald, that is absolutely amazing, the work that you have done. And with that, I would like to have my colleague, Kimberly Webster, come and share with us from within our NC HealthConnex clinical portal some additional examples and information that's readily available for everyone.
Yes, so you guys have heard our wonderful speakers talk about how they use NC HealthConnex to help providers and to help with patient care. And so I'm going to kind of show you in the demo environment what you would actually see. So first I want to show you how to get to the clinical portal. So you can go to our website, which is hia.nc.gov or www.nchealthconnex.gov. You're going to go to For Providers, and then you're going to click on For Providers, and you're going to scroll down to Provider Clinical Portal, and you're going to click. That will bring up the Provider Clinical Portal for you to sign in. Now, if you don't have credentials, your participant account administrator can email and request credentials for the users in your agency. But this is the login screen. This is what you'll see. So now I'm going to log into the demo. And before I do, I just want to kind of point out that anything of note will be here on this green screen. So just as for an example, this past weekend on Friday, I had a notice that, you know, the portal may be down on Saturday and Sunday for some maintenance. Here you can see that it says Internet Explorer is not a supported browser. So anything that's just kind of a, hey, this is what's going on with the portal will be here in this green box. Also down here, now again, this is the demo environment. You guys obviously would be in the live environment, but it just lets you know this is what you're agreeing to when you log in, that you are only going to access patient information for treatment, payment, or healthcare operation purposes as defined by HIPAA and as permitted by the North Carolina Health Information Exchange Authority Participation Agreement. I understand that all access of patient information is monitored and recorded. I will safeguard patient information from inappropriate use, and I will report any suspected breaches. I will not share my user ID or password with anyone. Pretty standard security language. And I just want to point out, you heard our speakers talk about bidirectional capabilities. So you can speak with your EHR vendor to see if you would be able to get bidirectional, which just means that you're sending data and receiving data through your EHR and not having to go to a separate web browser. So to access the clinical portal, you could go to a web browser. You can have that bidirectional capability within your own EHR, or single sign-on, which is also within your EHR. Once you log in, you're going to see this disclaimer. So the disclaimer is just to let you know, and we already had a question about this, that we do not accept 42 CFR Part 2 data, which is substance use disorder treatment data. We also do not accept psychotherapy notes. So you will not see that information inside the clinical portal. So that's what this box is letting you know. You're going to agree. So this is kind of the landing page. This is what you're going to see when you get inside the clinical portal. Your view may be different because remember, A, I'm, you know, a trainer, and B, this is a demo environment. So if you are a participant account administrator, your information is going to be right here where it says PAA tools. Now, the participant account administrator is very important, both for the HIEA and for your organization. Why? Because that is our point of contact. When we have questions or we need to reach out to your organization, that's who we usually reach out to, is your participant account administrator. For you guys, This is the person who actually requests login and credentials for the users at your facility. So if you have providers, nurses, CMAs that need access to the clinical portal, the participant account administrator is the person who handles those requests. And the participant account administrator tools is going to show you, this is the quarterly attestation. So basically what this means, and you'll get an email from us once a quarter that says, hey, it's time for you to do your user attestation. And so you're reviewing this user information to make sure that all these folks still need access to NC HealthConnex, and that you're removing anybody who, for example, everybody has turnover, somebody who's left your organization and no longer needs to have access. You would just simply click that attest to audit, fill in your information, and click the I attest to this audit. If you have any questions with that, by all means, you can email us. We're happy to help you with that. Also at the top here, messages, that is direct secure messaging, is basically a secure email, a secure encrypted email, right? It's a way for providers to message each other in a secure way. Most providers have access to that if they're in a large practice through their EHR vendor. But if you do not have access to direct secure messaging, we actually offer that service free of charge. You can simply email us and we can help you set that up. Also, here on this ribbon, I want to show you NC Notify. You've heard a couple of our speakers talk about NC Notify. This is where it lives within the clinical portal. That is our event notification service, and Tim Taylor is going to talk about that after me. This is CSRS, is the Controlled Substance Reporting System. So if you already have a login to the Controlled Substance Reporting System, you can access it through here. My account is just what it sounds like. It's your account information, your login information. If you click on the help button, it takes you to our website. And also on our website, we have training modules you can request that help you learn how to use the clinical portal, training modules for participant account administrator, and you can request live training. So if any of you see this and you're like, you know what, this is cool, I want to do this at my practice, then you just simply email us and we will help you with one-on-one training to show you how to use the clinical portal. So there's two ways to search, right? So you can search by MRN. Like, let's just say that, you know, you have the discharge paperwork from Atrium, and so you know the MRN. Then you can actually search by the MRN and the health system name. If you do not, and you're seeing this person at your practice and you're just trying to see, you know, or you're trying to close care gaps, but you've got first name, last name, date of birth, then you can search by demographics. Now, the thing is that, again, because this is a demo environment, I'm going to have, you know, one result. In a live environment, and you guys are familiar with this, if you've been in practice for very long, you can have multiple people with the same name. So it's best to search with as many demographics as you can to make sure that you get the correct patient. So now when you get to this screen, you see here where it says identifier, that number there, that is NC HealthConnex identifier number. So that's really not going to mean anything to you all. What you're going to be looking for is the name, right? The gender, the date of birth, the address, to make sure that this is the correct patient, that you're about to go into the correct patient's chart. Now, again, your view depends on your credentials and what kind of access you have. So in order to be able to view clinical information, you would have to have a clinician access. If you have clerical access, you can only view demographics. Now, we have had questions about demographics. I'm going to show you guys where that is at. If you wanted to see what information we have and where it is from, you can simply click on this little arrow here. You see here where this says identifier, DUHS, that is Duke University Health Systems. And after that colon, I don't know if you guys can see it, this would be that MRN number for that facility. These icons here show you what information we have. And if you don't know, if you can't see it, you can click on it. It'll give you the key for what those icons mean. If this is the correct patient, you would simply click on that patient's name, because anything you see that's blue is hyperlink. That means it's clickable. So here you get the break the seal or the declare patient relationship. So the first time you enter a patient's chart, you're going to have to declare a relationship. In other words, why are you accessing this person's information? So there's 4 reasons. It can be, I'm a clinician treating this patient. So, you know, I'm a registered nurse. If it was me and I was checking this information for my provider or to see if they went for a referral, I would click the I'm a clinician treating this patient. If you're a case manager, you would click care coordination. If you're a participant account administrator, you may be doing a quality audit check. But at any rate, you choose why you're going in this person's chart. and you declare that relationship. So now you're going to see, boom, the chart opens up, right? So again, we've had questions about demographics. So I'm going to show you that first. So the telephone number is right here at the top, but you can also go to patient demographics. You see this icon right here, and you can hover to discover. If you hover over that icon, it'll tell you what it is. You click on patient demographics and it gives you this key again, but you see this key is clickable. So I can click on patient demographics and it'll take me directly there. And there's the telephone number again. So the telephone number is in two places. And if you guys have questions or you feel like this is a little fast, I have included screenshots. They will go out when Kenya sends out the presentation. And again, we are happy to do one-on-one training for your organization. Again, I told you anything that's hyperlinked, that means it's clickable. So this is summary. There's two places to find information, and that is summary and then actually going directly to that tab. So under the summary, it's a little different because you're going to see here, right, it is just showing the most recent, the 5 most recent medications. Now there's paging, so you can go to the next page, but if you actually click on medications, you see how it's expanded because now we're in the medication section instead of the summary. So you actually have more information. Now, if you click on it, it'll actually give you whatever information we have. Now, that is the limitation to the clinical portal. We can only give you what we have, but we have a lot of data, you guys. 9,000 live facilities, 140 hospitals, connection to the eHealth Exchange. There's a lot of data inside the clinical portal. And I just kind of want to also go over, because we were talking about closing care gaps, right? So probably for specialists, for chiropractors, for, PM&R folks, you're going to live probably here in procedures and results. And just like in the lab results, it's just like you're used to in the EHR, anything that's abnormal is going to be in red. And again, you can click on it to see more information. And then, we were talking about transitional care management. Well, maybe you want to see CCDs. And if you do, they're here. And you can actually click on those continuity of care documents. And again, you'll see there's more hyperlinks. So let's say I just want to see, did they change any medications while this person was in the hospital? Let me look at this document and see what they did. I can click on that and see. And if I want to go back, now here's the neat thing, this little arrow, I can choose how far back I want to go. Do I want to go all the way back to patient search, or just want to go back to that EPR, that electronic patient record? And then, like I told you before, maybe you just need to see the discharge summary. If that's in the patient's chart, it will live here in the discharge summary notes section. There's also vaccinations, conditions, shows you both active problems and historical. So you've got present illness, past illness. There's just a wealth of information. And if you wanted to, you can actually do sorting. That's easier to do kind of when you have more data, but you can actually click and sort by most recent, or from soonest to oldest, or from oldest to soonest. If you wanted to, you can also click here. And then I just want to show you, if you want to, you can actually view that entire longitudinal record here on those. I'm going to show you again on these horizontal ellipses over here in the corner. And you will choose how you want to view this information. I'm going to choose PDF, and you're going to see it takes it a second because that's a lot of data. It's going to be 68 pages, right? If you want to see more, you can hit the expanded view, and again, it'll take it a second. It's a lot of data. And now it's 114 pages. You can also search. I had previously searched for medications, so it automatically came up, went to page 13 where the medications are. But there's a lot that you can do in this system. And like our speakers, talked about, there's a lot of valuable information that can help the provider to actually provide that comprehensive care for the patient. And so that is pretty much it for the clinical portal. I'll turn it over to Tim Taylor for NC Notify.
Thank you so much, Kim. And good afternoon to everyone that's on the call today. Really appreciate you guys being here. And anyone who's worked with me in the past has most likely heard me say that I believe that feedback is a gift. And so I'd just like to take this opportunity to really thank Mark, Terry, and Gerald for getting on the call today and just sharing your experience and the positive impacts with the work you're doing that it's having on so many citizens across North Carolina. So really appreciate you guys getting on here and showing the work that's currently being done today utilizing these services. And so to make sure that we have enough time for some good, to get your questions answered and have some good discussion, I won't be very long. I just wanted to point out two things that I felt were really important. I wanted you all to know that one, if you're already a full participant, you can enroll to these services today. And I'd encourage you to do that. And so, Kenya, if you can go ahead and pull up my slide, my first slide. Continuous improvement is the reason, is always on the forefront of my mind and our minds. And that's why I say that feedback is such a gift. Because we are always wanting to hear your voices, hear your thoughts and suggestions so that we can continue to make our services better for you. So just wanted to point this out again. If in fact you're already a full participant, even if you're not connected yet, you still can utilize the NC Notify service. And online, in the spirit of continuous improvement, we actually have a fully web-based enrollment form that is available to you on our website. So if you go to our website, there's a tab at the top that says services, and you'll see NC Notify underneath that tab. When you click NC Notify, there's a lot of really good information on that slide. And one, you can actually enroll totally right there from the website. So that's a new addition for you that you should find to be really convenient. I'm happy to help you with that enrollment if you have questions about that. The service overall is very customizable. We really try to tailor it so that it meets your needs. That's why Gerald's example was a great one. And they made it work for them, to meet the needs at their particular organization. But I'm happy to walk you through and help you with the enrollment process. But that's available to you today. So I just wanted to point that out. Excuse me. And I had a screenshot. Okay, here it is right here. So this is an idea of what you'll see. So that first page there, it just basically captures some high-level information about your organization, and it gets more in depth as you go on. I believe it's 4, maybe 5 pages. But again, I'm happy to help you in any way that I can. Please feel free to reach out to me. And Kim, if you don't mind, if you could just drop my email address in the chat so that it's available, to the group attending today, I'd appreciate that. Thank you. But as the bullet point suggests here, it's certainly more efficient. Detailed explanations actually can be found within the form itself. So basically what we've done is we've built some features into this enrollment form. As an example, if you go to a drop down, but you don't really fully understand what all the options are, on some of those, you can actually hover over the selections and it'll give you a brief description of what those options are. And also, because it's on our website, you have quick access to the frequently asked questions that are specific to NC Notify. Now, I mentioned continuous improvement. I want to show you 2 other examples, excuse me, on ways that we've tried to improve this process. So, as I mentioned, if you've signed the full participation agreement already, you're a full participant, and let's just say that in the case that you're not yet connected to the HIE, you can actually still use NC Notify, and all we would need from you is a panel or a member roster. That lets us know who you'd like for us to monitor for you. And we have heard some feedback in the past that some practices had some difficulty with submitting that patient panel. So we've put together a couple of new tools that should help, and some of the feedbacks that we've received since we've released these tools, very positive feedback. Let's go to the next slide, Kenya. And so it's 2 documents really. Well, one is a document, and what you're looking at here is our specification document online is around 18, 19 pages. We've condensed that document down to 1 page on how to submit a panel. what we found, or what we've heard, is that some of our practices were somewhat overwhelmed by a document of that size, trying to, read through all the technical jargon. We really tried to simplify it for you here with this single page document. Some of the feedback we've received said it's far more efficient, and I know for sure that it has certainly helped to decrease some of the onboarding time. And I won't read through them all, but it's just 7 quick steps on things that you need to do as a provider to successfully submit a patient panel. And this document really helps to support the next slide, which is a screenshot of a template that we've built and put together for you. And so step 1 there will tell you that you need to extract a list of patients that you want us to monitor for you out of your EMR. The next step, Kenya, if we can go to the next slide, will show you the template that we've built. And so what makes this really important, on that first row number 1, going all the way across, there's a very specific way that those column headings needed to be listed. And that was a real pain point for a lot of providers. So basically, we built the template for you where we went ahead and populated that row for you. So this is really a very convenient, or far more convenient, way of building a patient panel, and then you can actually drag and drop, and then the other steps on the sheet that you saw before will show you how to successfully send that over to us for review. So that my section is going to be very short, but I just wanted to point those things out to you and let you know that if you are a full participant, even if you're not connected, you can enroll and utilize NC Notify. So encourage you to do that. Reach out to me if you have any questions at all. I believe Kim has dropped my information in the chat, and please consider it. I strongly recommend the service. It's a wonderful service. And as our presenters have shared with you today, it's really having a positive impact on the lives of those that we take care of. And with that, Kenya, I'll give it back over to you. And thanks again, everybody.
Thank you, thank you, thank you so much, Tim. We've had some really good questions to come into the chat and the Q&A, as well as we've had several team members to respond. Thank you even to our technology partners over at SAS. I saw Paul responding to a question over there. We are very appreciative for the team effort. Want to give a couple of shout outs. On February the 15th of this year, the Health Information Exchange Authority launched the Stroke Registry, the latest population health tool to join our robust suite of services. This is a dashboard that supports the Division of Public Health by using demographic and clinical data on stroke patients that are received by NC HealthConnex. Some of the goals of the Stroke Registry project are to improve the system of care for stroke patients in North Carolina, to address disparities in health care, and to identify areas in the stroke care continuum where interventions may be needed, whether that involves stroke prevention or post-stroke care measures. In addition to that, we've added some new team members, as well as we've had some current team members that were promoted. So we'd like to give a shout out to Janelle Stewart, who's been promoted to Assistant Director of Health Analytics and External Services. I want to welcome Regina Cucurulo as our Deputy General Counsel. We want to welcome Valerie Williams, who's accepted a full-time position as a Provider Relations Specialist with our team. And lastly, we want to welcome Rebecca Fine, who's accepted our Population Health Data Analyst position. And in addition to that, we know we shared this with you on our last Teletown Hall, but we really want to promote and share with you the video that was created by our outreach and communications team that really helps to promote NC HealthConnex. This is a great tool to share if you have any new team members that you want to level set with them and explain what NC HealthConnex is. This is a great place to start by just sharing that video with your team. And again, as Tim stated, we are very thankful to our partners who have joined us. We also want to thank again Terry, Mark, and Gerald, but we want to share with you how you could also benefit from the services of NC AHEC. The coaches work one-on-one with independent primary care practices, specialists, FQHCs, which are federally qualified health centers, rural health centers, health departments, primary care services, behavioral health providers, and some health systems primary care or specialist practices. In order to find the regional area health education center, we do have here for you the map that gives you where the regional AHEC is located, and it also has contact information in the form of phone numbers and emails so that you can reach out to the area health education center in your area to get assistance from some very helpful and knowledgeable practice support coaches around the state. And with that, we do want to also invite you to reach out to us if you have questions at hiea@nc.gov. If you have questions that are technical in nature, please reach out to our technical support team at hiesupport@sas.com. And as Kim mentioned, if you would like additional training, we know that we cannot answer every question and address everyone's issue on this particular 1 hour Teletown Hall, but we do have a link here provided for you where you can request additional training as well as you can request access to our pre-recorded training modules. And save the date on June the 7th of this year, we'll be having our Q2 Teletown Hall. And we'll be making announcements as we get closer to that date with regards to the subject and any speakers. And with that, I'm going to stop sharing so that I can go back to the Q&A and see if we have time in the next 8 minutes for any of our speakers to address questions that they haven't responded to yet. I did notice that some questions were coming in the chat and some were coming in Q&A. So let me go to Q&A and see what I can find. And if Kim or Brittany, anyone can help me to address a question that hasn't been answered. I think most of them have been answered. Just one moment. Awesome. Thank you so much, Terry. I see that Terry has shared that NC AHEC practice support is free to all practices as is funded through the state as well as some grant funding. So thank you so much, Terry, for sharing that information with everyone. The link to the video will be shared in the follow-up materials from today's Teletown Hall. So you will receive a link to the video as well as all the other materials that we've shared today. Well, thank you. We have a great comment from Kimmy that said that the process to get signed up and make corrections was seamless and very easy. It took them less than a day for their staff to get enrolled. We love that feedback. As Tim stated, feedback is a gift, and we appreciate that positive feedback on today. We do work really hard behind the scenes so that providers don't have to wait to receive access to our suite of services. So we appreciate that. I believe this question has already, okay, go ahead.
No, I was going to say somebody had a good question. They were, basically saying, okay, well, this is great. How do we get this? And I was just letting them know that, a lot of our services are by request. So I don't know if you wanted to talk about that some.
All right. Yes, like Kim was stating, if you want to have access to our clinical portal, simply have your participant account administrator reach out to us at HIEsupport@sas.com, and our technology team will work with the participant account administrator to make sure that credentials for the clinical portal are obtained, as well as Tim stated, you don't have to be live and sending data if you have a full participation agreement to enroll in NC Notify. And as he walked you through the steps of the enrollment process, again, those links to the enrollment form, the web-based enrollment form, will be sent out post this training, so you'll be able to follow those steps and immediately enroll into that service immediately so that you can get access to that dashboard as well. Thank you so much, Kim, for highlighting that, because it is so hard behind the scenes in this little square to keep up with these questions. I thought I saw one for Terry earlier, but I don't know if it was addressed and I'm unable to find it. So I'm trying to see if I can't find it in the background. Okay. And if anyone finds it before I do, please help me out. I do see a question for Gerald, and Gerald, I apologize if you covered this, but one of the questions, and you may have answered it in the chat or directly to the person that asked it, but they were asking, does it require you to have a secure file transfer protocol to connect in order to receive those notifications?
For the NC Notify, yes, and we specifically use the hourly batch methodology. So we use the near real-time methodology by using an SFTP connection to get all of new transactions every hour.
Awesome. Thank you so much for that, Gerald. Appreciate you coming back on to help answer these questions.
And Kenya, I'd just like to point out, just as far as patient panels being submitted or uploaded, if you will, there are some other options as well. There are other ways that you can either send us panels or have a notification file sent back to you. SFTP, as Gerald mentioned, is one of the options, but we also have a panel uploader that can be found on the portal. And then there's also a DSM option. If you have a direct secure message address that you'd like to use, we can work with you to help you submit panels that way as well. So I just wanted to point that out, that we do have a few other options.
Kenya, I found that question for Terry. Do you want me to read it?
Yes, please. And I also found a question for Tim.
Oh,
Go
good.
ahead. Tim.
Okay. Yeah, it just says, hi, Terry, can you please share the filters and NC Notify that are being used in the nephrology practice? And the person that's asking works in nephrology, and that's why they're asking.
Sure. And this is actually great for neurology. If you've got Parkinson's or specific conditions, or any specialty where you're really managing, but specifically for neurology and dialysis, we met with Tim. And Tim, you want to take the tail end of how you submit the panels up to you all, so it's not 100% everybody? Because one of the things we were finding in nephrology is a lot of the one visit hypertension patients who really did not end up staying in nephrology. They were referred for a one visit. They were getting all sorts of NC notifies on them when they were getting stitches at urgent care and things like that. So we condensed it to the dialysis patients, or you could do transplant patients, or whatever panel you want. And Tim, you want to take that away, because that's you.
Sure, yeah, I can help with that. And the filters, I mentioned the NC Notify in general was, we're very flexible. We try to be, to meet the needs of the providers. And the same is true for the filters. So when I'm doing those trainings, they're really tailored to the practice and the provider type. Because, and so the one that Terry described was really tailored for them. But I'm happy to work with you and teach you how to fish versus, providing you with the fish. But there's a number of ways that we could set up those filters. You could look, for example, if you're looking for only hospital discharges, we can do that. Or the hospital discharges within the last 24 hours, or ED registrations within the last 24 hours or 48 hours. I could certainly help you to, build those as well. But case in point, it's really tailored to the needs of you at your practice. So any way that I can help, please let me know.
Awesome, awesome, awesome. We're going to stop here. We are at time, and there are several questions that did not get answered. Again, thank you to Mark, Terry, Gerald, Kim, Tim, Brittany, Jesse, Paul, Holly, everyone work behind the scenes to help us answer the questions, and we will be responding to you directly if you did not get your questions today. Thank you, everyone, and have a wonderful day. Bye.